Every minute of every day, somewhere in the world, someone experiences a sudden disruption in blood flow to the brain. It does not always begin in a dramatic way. In fact, in many cases, it starts quietly, with small temporary changes that disappear before they are fully understood. And this is exactly what makes this topic so important. Because the brain does not always fail suddenly. In many situations, it gives early signals long before anything serious happens. These signals can appear hours, days, and sometimes even weeks in advance. The challenge is not that the body stays silent. The challenge is that most people are never taught what to listen for. Before we go deeper, if you find this kind of calm, simple explanation helpful, I would really appreciate it if you subscribe and share this video with someone you care about. My goal is simple: to make this information reach the people who might actually benefit from it. Now let's continue. What we call a stroke is not a single event with a single cause. It is a general term that describes two different situations inside the brain. One happens when a blood vessel becomes blocked. Blood can no longer reach part of the brain, and that area begins to struggle very quickly because brain tissue depends on a constant supply of oxygen and nutrients. The other happens when a blood vessel becomes weakened and allows blood to leak into surrounding tissue. Both situations are serious and require attention, but they develop in different ways. In this video, we will focus mainly on the more common form, where blood flow is interrupted by a blockage. To understand why timing is so critical, we need to understand one simple fact. The brain is one of the most energy-demanding organs in the body. Even at rest, it uses a large portion of the oxygen and glucose circulating in your system. It is never truly off. This constant demand means that even a short interruption in blood flow can affect function very quickly. Brain cells are extremely sensitive to oxygen levels. When supply drops, they begin to struggle within minutes, and the changes can become irreversible if the interruption continues. But here is something many people are never told clearly enough. In most cases, the final event does not appear suddenly without warning. It is often the result of a long, gradual process happening inside the blood vessels. Over time, the inner walls of arteries can slowly change. Small deposits may build up. The vessel becomes less flexible. Blood flow becomes less smooth. At first, the body compensates, and there are no noticeable symptoms. But occasionally, the system sends short warning signals. These signals are brief, sometimes so brief that people dismiss them as nothing important. In medical terms, one of the most important early warning signs is called a transient ischemic episode. This is a temporary reduction in blood flow to part of the brain that resolves on its own. These episodes can last from a few seconds to several minutes. Because everything returns to normal, most people assume nothing serious happened. But in many cases, these episodes are a signal that circulation is becoming unstable. Some medical studies suggest that after such an episode, the risk of a more serious event can increase in the short term. This is why doctors take them seriously, even when symptoms disappear completely. The real challenge is awareness. Most people do not recognize these episodes for what they are. They think it was fatigue, stress, dehydration, low blood pressure, or simply one of those strange moments. Now let's go through the main warning patterns in a clear, practical way. The first sign is a sudden change in vision in one eye. It may feel like a shadow moving across the field of vision, a curtain dropping, or a temporary loss of clarity. Some people describe it as fog, grayness, or a partial blackout in one eye. It usually lasts only a short time and then disappears completely. This can happen when a small particle temporarily blocks a vessel that supplies the eye. Because the eye is directly connected to the same vascular system that feeds the brain, this becomes an important warning sign. Even when vision returns to normal, the key issue is the interruption itself. Think of it like a power flicker in a critical system. Even if everything comes back online, the fact that it happened matters. Many people ignore it because the symptom disappears quickly. But in medical practice, this is often treated as a signal that requires evaluation. The second sign is sudden numbness or unusual sensation on one side of the body. This may affect the face, arm, or leg. It can feel like tingling, heaviness, reduced control, or a strange disconnect from that side of the body. A common misunderstanding is that people assume it must be related to sleeping position or nerve compression, and sometimes that is true, but those causes usually have a clear physical trigger. In contrast, this type of episode often appears suddenly without warning, while sitting, walking, or even talking. When symptoms affect only one side of the body, it often reflects temporary changes in blood flow to the opposite side of the brain. Even if it resolves within minutes, it should still be taken seriously, especially if it has never happened before. The third sign involves coordination and balance. A person may suddenly feel unsteady, as if walking is slightly off. Steps may feel uncertain, or the body may drift unintentionally to one side. Sometimes it feels like brief dizziness or a sudden wave of imbalance, even without changing position. This happens when areas of the brain responsible for coordination temporarily receive less blood flow. One important detail is unpredictability. Unlike inner ear issues, which often have clear triggers like head movement or position changes, this type appears suddenly and without explanation. Many people later describe it as, "I just felt off for a few seconds, then it was gone." The fourth sign involves speech. A person may suddenly struggle to find words, form sentences, or speak clearly. In some cases, speech becomes slurred or broken. In others, understanding spoken language becomes temporarily difficult. What makes this especially noticeable is that the person experiencing it usually realizes something is wrong immediately. It does not feel like normal forgetfulness. It feels like a temporary failure of communication. Even if speech returns to normal within minutes, it should not be ignored. Occasional word-finding difficulty due to stress or fatigue is common. What is concerning is sudden, unusual breakdown of speech ability. The fifth pattern is more indirect but still important in context. In some individuals, long-term inflammation in the body may gradually influence the condition of blood vessels. When the inner lining becomes less smooth, circulation can slowly become less stable. This does not mean a single symptom indicates a serious condition. It means patterns over time matter more than isolated events. Headaches are often discussed here, but they are extremely common and usually linked to posture, stress, hydration, or neck strain. The important factor is change in pattern, especially when new symptoms appear alongside other risk factors. Now let's step back and talk about what actually affects blood vessels over time. One major factor is blood sugar regulation. When blood sugar remains elevated over long periods, it can gradually reduce the flexibility of blood vessel walls. This process is slow and often silent. Many people are unaware of it until routine testing reveals changes. Another factor is smoking, which exposes blood vessels to continuous chemical stress. Over time, this can affect circulation and increase the likelihood of clot formation. Blood pressure also plays a major role. Consistently high pressure can gradually weaken vessel walls. At the same time, sudden drops in pressure may reduce blood flow in already narrowed vessels. Age is another factor, but it works gradually rather than suddenly. Risk increases over time, especially when combined with lifestyle and health conditions. What matters most is not fear, but awareness of how these factors interact over time, because many of them can be influenced through long-term habits and medical guidance. If someone experiences any of the warning signs we discussed, even briefly, it is always reasonable to take it seriously and seek medical evaluation. Doctors may recommend tests such as imaging of neck arteries, long-term blood sugar monitoring, or heart rhythm evaluation. Each test helps understand whether there is an underlying pattern that needs attention. The goal is not to assume the worst. The goal is to understand the situation early enough to respond properly. Before we finish, it is important to bring everything together. These signals are not meant to create fear. They are meant to improve awareness. The brain often gives small warnings before larger problems develop. The challenge is recognizing them in time. The earlier these patterns are understood, the more options there are for prevention and support. So if you remember one thing from this video, let it be this: sudden, unusual changes in vision, speech, balance, or sensation should never be completely ignored, even if they disappear quickly. They deserve attention and proper evaluation. And beyond that, long-term brain and vascular health is shaped over years, not moments. It is built through consistent choices, awareness, and timely responses to early signals. Take care of your health in a steady, informed way, and use awareness as a tool that supports calm decisions rather than fear.